If you're a frequent runner, or even if you've just been starting out, then you'll probably experience a few different aches and pains while you've been out pounding the pavement or even on running tracks. This series of short videos will explore 5 common running injuries that we see in our physiotherapy clinic, Leading Edge Physical Therapy, and outline some really useful ideas to help alleviate these issues. Hi, I'm Andrew Darcy. I'm a sports physiotherapist from Adelaide in South Australia. And on the first of our list of common running injuries is pain at the front of the knee, known as runner's knee. The technical name for this pain is Patellofemoral Joint Syndrome. This is where the pain at the front of the knee is coming from the back of the kneecap, known as the patella. Patellofemoral Joint Syndrome is a very common injury to the knee and it can be caused by things like abnormal biomechanics of the hip, knee or foot, or poor muscle activation around the quadriceps. Even overuse can be a major issue here. It's often described as vague pain, which is hard to pinpoint and felt mainly around or just behind the kneecap with running, stair climbing and running down hills. So how do we treat runner's knee? Well, initially the main aim of treatment is to decrease the inflammation around the knee and to take the load off it. This doesn't mean that you have to completely stop moving, it's just that it means that you need to reduce the amount of activity to a level which doesn't aggravate your knee, and so that the pain doesn't last for hours afterwards or into the next day after running. The use of ice, taping techniques and anti-inflammatory medications can also assist in reducing pain and inflammation initially. The next step is to correct the abnormal biomechanics that may be causing the pain. So this may involve the stretching of tight structures, particularly the muscles on the outside of the thigh, and strengthening the weak muscles, commonly the hip abductors or gluteus medius, and the muscles just above the knee, known as the VMO. At Leading Edge Physical Therapy, we work closely with the team at the Biomechanics Lab, which is Australia's only private 3D biomechanical analysis system. This is the best way to identify if you have any underlying biomechanical faults in your running and to determine what's actually causing your pain. If you have any pain at the front of your knee, I'd highly recommend that you make an appointment to see Chris and the team at the Biomechanics Lab, and they'll get you moving in the right direction. Stay tuned for the other common running injuries in this series so you can see how you can improve your running and get back to running pain-free.